I'm Carlos Torrado. I'm Executive Director of Austin Oaks Hospital in Austin, Texas. I'm a psychiatrist and I specialize in the treatment of addiction and co-occurring disorders. Here at Austin Oaks, we offer alcohol withdrawal management, also known as detox services for patients who admit to the hospital. We're able to provide the necessary medical treatment and support to handle really up to moderate to severe levels of withdrawal. We see individuals who are drinking, who are trying to quit, sometimes unable to stop drinking because of the overwhelming impact of physical withdrawal symptoms like shakes and sweats and nausea and vomiting. Sometimes even seizures can happen. So here at Austin Oaks, the goal for us is to ensure that we keep people who are withdrawing from alcohol safe by incorporating evidence-based medication protocols, and we can safely bring people off alcohol, usually over a 3 to 7 day period, depending on how severe the symptoms are. A medical setting is important during detox from alcohol because unlike some substances that people withdraw from, alcohol withdrawal can be potentially life-threatening. Individuals who are at high risk for severe alcohol withdrawal can have seizures, delirium, and require high-intensity hospital services. So a medical setting like Austin Oaks is able to provide that kind of 24-hour nursing and medical presence with ongoing protocol support to ensure that people are safely withdrawn from alcohol and don't suffer severe complications. Most of the people who admit to the hospital have some other kind of co-occurring problem, be it depression, anxiety, post-traumatic stress disorder, bipolar disorder. In many instances, their use of alcohol feeds that problem, or vice versa. Sometimes individuals with mood problems, when they're in the middle of an episode, can use alcohol in effect to self-medicate. So being able to correctly diagnose a co-occurring condition is one of the strengths that we have here. And on top of that, we can initiate the appropriate medication and behavioral therapy to be able to address those needs. Group therapy is an important part of the recovery process for people who are trying to recover from a substance use disorder. Even during an episode of care like a detox admission, individuals benefit from community, they benefit from connection. They benefit also from the types of skills in terms of stress management, anxiety management, family dynamic education. All of those things that occur in a group therapy format can also benefit individuals who are really starting their recovery journey on detox. The other thing I want to emphasize is that for most people, detox is just the beginning of overall recovery journey. You can start that in a place like Austin Oaks, and we can support you and ensure that if you need to continue on, say, to a treatment program, or if you need referrals to outpatient practitioners who understand what the needs are treating chronic alcohol use problems, our case managers and staff are able to facilitate referrals so that you can successfully get to the next phase of your recovery.